You're watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. Today's topic, a smarter way to brush. My first guest has invented, he's the co-founder of Feno, and it's really the latest technology to keep your teeth clean. And it's got a prevention part of it too. And with us we have an oral surgeon, Dr. Kenny Brown. Dr. Brown, welcome to the program.
Thank you for having me, Randy.
Okay, good. So you brought the device in
Yes.
here. And for people that don't know what this is, what is Feno?
Yeah, so Feno is an oral care platform. We've created the Smartbrush, which is a smarter way to brush your teeth.
Okay.
Right? So think of it as a full mouth brush. You can get a comprehensive clean in just 20 seconds.
Okay.
A better way to brush your teeth in 20 seconds.
All right. And we had a little discussion on the phone. And I said, look, if what you're saying is true, because you have the data on this, that it cleans better than a traditional old-fashioned toothbrush.
Yes.
And you can do it in 20 seconds. So that's upper and lower 20 seconds, or 20 seconds on the lower, or 20 seconds on the upper.
Whichever way you choose. But the trick here is that the technique is built into the brush, right?
Okay.
So the way that the bristles are angled, the density of the bristles, there's 18,000 bristles here, right?
Okay.
Versus the couple hundred that you have in your brush head. It's a brushing in a much more deliberate fashion. So it's actually removing plaque from your teeth, giving you whiter teeth, giving you healthier gums, and allowing you to get that comprehensive, like dentist-like clean in just 20 seconds at home.
Okay.
Yeah.
I told you on the phone, and I even told my team, I said, it almost sounds too good to be true, right? Because if you use a standard toothbrush, I was doing it this morning, it's 2 minutes,
Yes.
right?
Yeah.
It seems like a long time. So if I could do the same thing in 20 seconds, why not?
2 minutes is an eternity, right? When you're trying to brush your teeth, you got the kids hanging on you, you got to rush to work, or you're trying to get to bed, you're sleepy. What ends up happening is we just fall short. Only 30% of people brush their teeth correctly. Only 30%.
Okay.
So 3 in 10 people that you walk across and you talk to, that the reason their breath is smelling the way it is because they're not brushing their teeth correctly. And this goes beyond just white, straight teeth. This actually affects our heart, our lungs, our gut, our soft tissue, etc.
Okay, so beyond a cleaner way to brush your teeth, a better way to brush your teeth, it has some other things. Tell us a little bit about the technology and what it's doing.
Yes, so there is actually a scanner in the device. The scanner is allowing you to get insights into what's happening inside your mouth, right? We track all kinds of things. We track our steps, we track our heart rate, but this allows you to track your oral health. So before you have gum disease that requires a $2,000 deep cleaning, or or decay that causes a $2,000 crown, we can catch that early. We can catch it when it's barely a tiny cavity, or when it only costs you $20 or $100, or you can get it just with a simple clean.
So what is it measuring? Okay, so you put it in your mouth, and what is it? It's like a computerized system.
Yes.
What is it measuring, and why is that important?
Yes, so it's measuring your teeth, your gums, your soft tissue, and your tongue. And all these are components that make up your oral health, right? So your teeth, you're looking for any color change. Your gums, you're looking for a color change or maybe some infection. Your tongue, you can tell all sorts of data from your tongue.
Like what?
Micronutrients, macronutrients, autoimmune issues, cancer. Soft tissue, same thing. So this is giving you all this information from the comfort of your own home.
Now you told me gum recession, it'll detect.
Gum recession, why is gum recession even important?
Yeah.
Is the bigger question.
Okay.
Because it's an infection, right? We don't want to walk around with an infection.
Okay.
It's an infection that the bacteria can go to your brain, your heart, your lungs. I'm sure you've heard, or maybe you haven't heard, but there are people dying in the hospital from brain abscesses, not because they have some sort of infection in their leg or anything, from their mouth. And it's all preventative. We just need to brush our teeth.
Okay, so it will measure gum recession. And then what? It gives you a readout, it sends you an email.
Yes.
And what do you do with that information?
Correct. So we will send you Feno Insights, or an oral health report that'll give you commentary on what's happening in your mouth. It'll give you a score, a relative score. It'll also give you commentary. So like I talked about, color change in texture, change in shape. All these things are signs of something else going on, right? Things that we want to prevent, things that we want to get ahead of. And you may not know because you may never feel it, right? But it's like getting a dental exam in your bathroom.
Okay, so you mentioned shape. Okay, so if your teeth are changing shape, that's going to detect it. So if somebody's like a grinder and they're not aware of it because they're asleep, will it detect that?
Exactly.
Okay.
So let's talk about shape for a minute, right? We want to tell about the shape of your teeth because if you're grinding, could that mean you have sleep apnea? Could that mean you're overly stressed? Could that lead to a potential fracture in your tooth? Could that mean erosion or high acidity, right? So every little piece that we're detecting leads to a bigger issue that we're trying to prevent.
Okay. Now, we talked on the phone. You said your why was important.
Yes.
So let's talk about that, because you felt that was important to talk about.
Yeah, my why is I'm interested in scaling care. As an oral surgeon, I live at the intersection between dentistry and medicine. And there's often times where I'm in the hospital taking out all their teeth because of the plaque and it's gonna affect their cardiac surgery. Or I'm treating the brain abscess patient because they had an infection in their mouth. And to know that's all preventable, it just seems ridiculous to me. And the thing is, we're just using the same old technology from the Middle Ages, a stick with some bristles on the side, right?
Okay. Now, do you think this is the future of toothbrushes? I asked you this in the. I know this isn't a toothbrush, right? It's much more than that.
Yes,
right? As you say.
Yes.
Right?
Yeah, we're more than a toothbrush.
Like, it was a dirty word when I said, "Is this just a better toothbrush?"
Yeah, we are much more than a toothbrush because I want you to think holistically about
so
your
in
mouth.
15 years, 20 years, or 100 years, you think the traditional toothbrushes we know that today will all be replaced with devices like this, which is a better way?
We'll be gone. We should hold a funeral for our toothbrush as it currently sits. Because look, if I told you that you get a better clean in 20 seconds without having to worry about if you're having the right pressure, if you're having the right motion, do you have the right brush head? Are you doing the right technique? Do you have the right toothpaste?
Okay.
Would that help you switch?
Yeah. Now, I look at that, and knowing you were coming, I've done some research. There's there's things that look like that on the market. Is this different, or are they all the same?
Yeah, look, I think this concept of brushing all your teeth at the same time is not novel. It's a great idea.
Okay.
What we noticed is that there were some issues with it. We noticed that the bristle density, the number of bristles here, the quality of the bristles here, the quality of the movement, addressing you as an individual because your teeth are going to be shaped differently than my teeth.
Okay.
All make a difference in the efficacy or the ability to clean your teeth. And so we went above and beyond, and we spent 5 years and multiple millions of dollars to making sure that when I give you this device, I can feel confident as a provider, as a dentist myself, that you're going to have a comprehensive clean each and every time.
So the ones that are on the market today, the ones you've researched, because I haven't done that research, is it more of a one-size-fits-all brush, and you say this one is customized? How are you able to do that?
Yeah,
you send them a kit, like a mold kit? What do you do?
Yeah, so they are typically one size fits all, and it's not really the shape of a dental arch. The dental arch is very nuanced in its shape. We actually size you. We take a quick 5-second selfie of an open mouth selfie. We're able to map your arch, basically size it, the width, the shape of your teeth, the shape of your mouth, and give you a specific size on your brush head. Right, so this size is custom for you.
So a selfie, what?
Yeah.
What does it look like? So you just open your mouth,
take a
picture,
take a selfie.
Your computer software will map out the upper arch and lower arch,
so that we can give you the right size.
Is that right?
And the reason we're doing this is because the name of the game is bristle contact to your tooth surfaces and your gum line. And if we don't have that, we don't have anything that's clean.
It seems pretty tight. When you handed it to me over there, and I'm not trying to endorse this because I've never used it, but it seems like it's very tight against your teeth.
Yes.
So they all kind of vibrate, but you say yours has a different way of doing it, a different mechanism.
It's a more deliberate brushing mechanism.
What do you mean?
Meaning that you can put your phone in your mouth and it'll vibrate today.
Okay.
But that's not cleaning your teeth,
okay.
Right? What you see with our device is that it allows the nylon bristles to sweep, just like we sweep the floor. It's very simple. It's very simple physics. That the nylon needs to sweep across the teeth and across the gums to remove that plaque and bacteria.
Aren't they all doing that? These other so-called competitors or lookalikes, I should say?
Well, studies have shown in their clinical trials that they're not removing it. And when we've done trials ourselves, we're showing that we're removing it.
So you have a different brushing mechanism, the way it contacts
different
the
brushing
teeth.
motion. We're using the same principles as we know about brushing our teeth, that we need to have certain angle to our teeth. We need to address the gum line. We need to have a certain motion. We just built it into the brush so that you don't have to do it. Because when we have to do it ourselves, we tend to fall short. Because we're sleepy, we're tired, we're lazy, right?
Okay. Now, do you have special toothpaste? Can you use your regular toothpaste with this brush? How does that work?
Yeah, we have a foaming toothpaste. The foam allows for better distribution. It allows for easier cleaning and less waste, right? If you use traditional toothpaste, it's a lot of area to cover and it gets gunked up. And I'm not sure if you've looked at your toothbrush lately, but there's probably some toothpaste crust on there. And so with our foam, that's eliminated.
Are there any whitening agents in this foam?
Yes, there are whitening agents. It's designed to keep your teeth clean. There's regenerative agents such as xylitol. I'm not sure if you've heard of xylitol, but xylitol is a plant-based sweetener that actually has been shown to basically repair your enamel, much like fluoride.
So it tastes pretty good.
Tastes great.
So it's like a sweetness to it, right?
Yes.
Without the sugar.
Yes, no sugar. Yes, exactly.
So 20 seconds a day, and twice a day or every time you eat a meal? Because that makes it easy to brush after every meal, right?
Which you are more than welcome to. We empower you to have a better oral hygiene routine. We would recommend a minimum of twice a day, just like your normal brushing technique. We recommend you change this brush head out every 3 months, just like your normal brush, just to make sure that we don't accumulate any bacteria.
How much are those to replace every 3 months?
So we have member pricing and non-member pricing. If you are a member, means that you are part of the digital plan. You're getting those oral health reports on a routine basis. You get it for a discount of $14.
So $14 every 3 months?
Every 3 months.
Okay.
Yes. And then $25 if you are not a member.
All right. And then, so with this data, could it be sent to your dentist? And what
yeah.
do dentists so far think of this?
Yeah.
Because you're fairly a new company.
Yes,
right?
yes. So you can send the data to your dentist and have a much stronger relationship. You can hold it to yourself if you would like. Dentists are intrigued. They're excited that another dentist has decided to take on this category because it's the principles of cleaning your teeth have been ignored for so long, right? It's been about white, straight teeth. Great.
Yeah.
But we need to really think about what the power that the mouth holds, right? We've seen this as we've started all had to do COVID tests with our mouth, the saliva, the bacteria, the gum disease. This is what's actually killing us, not having crooked teeth.
So, as an oral surgeon, and you talked about it a little bit, but you meet people at end stage of their gum infection, gum disease, or maybe they have the way their teeth come together is making them lose their teeth. So are you convinced, and you probably don't have the proof on this yet, that if they do this 2 times a day, 3 times a day for 20 seconds, that it will keep people from losing their teeth ultimately and ending up in your lap?
Yeah, I'm putting myself out of business here, right?
Okay.
The idea is to eliminate the need to get to that end stage where the tooth issue becomes a life-threatening issue. When a gum infection leads to tooth loss, which we know is a pandemic or epidemic in this country. Using this twice a day, using the scanner to catch these conditions early are all in the spirit of maintaining a healthy mouth and preventing that end stage issue.
What about the floss? Do you still floss?
We still recommend a floss with this. Yeah.
Water pick or floss? What do you think?
I like both of them.
What's your own opinion?
I say do what you're actually going to keep up with.
Okay.
Because I think they both work. But what works the best is whatever you are actually willing to do.
What about people that have artificial teeth or like veneers or maybe a full arch of dental implants upper and lower? Can they use this as part of that?
Yes, they should. They can use it as a part of their protocol. But with the veneers or with implants, full arch implants, bridges, you need to make sure that you floss underneath those and clean those thoroughly.
Okay, so if somebody orders this today, they're going, okay, I like this.
Yes.
What are the steps? How long does it take to get it going?
Yeah.
How hard is it to connect with your phone?
Yeah.
And do you have to connect to the phone?
Great
you
question.
Just use it as a toothbrush?
Great question. You can just use it as a toothbrush if you would like.
Okay.
You will miss out on some of the benefit as it relates to those oral health reports if you don't connect it.
Okay.
You can get this on feno.co. feno.co.
We'll have that at the bottom of the screen.
Great. You can get that. You can get it there. You'll get an email that says, hey, time to take your fit kit, where you take that quick selfie. Take that quick selfie. Your smart brush will be on its way and you're ready to go.
So from the time you take your selfie, set it to Feno.
2 days.
And then you get this in the next week or so.
Yes. Yeah.
Depending on where you live.
Depending on where you live. Yeah. Exactly.
And then it's a pretty easy setup.
It's a very easy setup. It'll come charged. You press the on button and you'll be able to start brushing right away. You can connect after you start brushing if you just want to stick it in your mouth really fast, which most people do. But yeah, you'll become ready and you just put it in your mouth and start brushing.
So this is the future of
the
way people clean their teeth.
This is the future of healthcare, really.
Look, I have a lot of the anti-aging medicine doctors, integrative medicine doctors, functional medicine doctors on the show. And just about every book, including Bredesen's book on the end of Alzheimer's, they're saying if you have bleeding gums, that if you have a bacterial infection in your mouth, that it that it can travel to the brain. And so I guess, and all of the anti-aging books are saying that if you have, they talk about leaky gut and problems, now they're calling it leaky mouth. So do you believe that this will help with all of those things if you do it early enough? Because prevention, as we talked about, is very tough to sell.
Absolutely. But it's about the routine. It's about the basics, and that's taking care of your mouth. And where does that start? It starts with brushing your teeth, right? And if you can't brush appropriately, then we can't prevent that bacteria infection that's in your mouth that's going to your brain, or the leaky mouth syndrome. It starts with brushing your teeth.
Why did you pick 20 seconds? Did you look at the data and that's all you needed?
It was a no-brainer. Well, 20 seconds is a no-brainer. But yes, it's about the data, right? It's about the data of like what is actually an effective clean. Our number one priority here is efficacy. Number one priority is efficacy. It has to work. We can have a great brand. We could talk a great game, but if it doesn't work, it doesn't matter, right? And at the end of the day, efficacy is our number one priority.
So people are ordering this, reordering it.
Yes.
People that use it love it. What do they say? What's the feedback so far?
That I'm so happy that it works. It blows my mind. 20 seconds is fantastic. Didn't realize how much time I'm saving. That's what we're hearing.
Does your whole family use it?
My whole family uses it. I'm experimenting on my kids because we're coming out with the kids version soon.
Now, look, I think of it, just listening to you, as a faster way to do this in 20 seconds, right? But you're an oral surgeon. Knowing what you know, right, about early tooth loss, things like that, what's the most important thing to you about this?
Is
that may be hard to explain to patients or people?
Yeah, that with consistent oral hygiene routine, oral care, that we can prevent so much headache down the road.
Because it's expensive. I mean, crowns are like $2,000.
Crowns are $2,000. Deep cleans are every 3 months and there's $1,000, right? We're talking about the headache of spending money at your dentist or the health benefit.
Okay, so this is about $300. Is that correct? How much is it?
$300 for what you see here, 3 months worth of toothpaste, and a free trial of those oral health reports.
And in the long run, it could potentially keep you from getting that crown or a trip to the endodontist that does a root canal.
Absolutely. Absolutely. In the long,
is it really that simple?
And when we say long run, we're only talking about a year, right? If you go to the dentist once, you're gonna see how much you have to pay to get treatment.
Okay, so if you're using this for a year in the future, and all of a sudden it comes back, you've got changes to your tongue, bumps on your tongue.
Yeah.
Does that mean that potentially you're grinding? Does it potentially mean you have some pathology, some problems? Tell me about that.
Yes, yeah. So when we look at the tongue for a lot of different reasons. The tongue can be insights into different pathologies. Okay. It can be insights into something that's maybe irritating your oral cavity, maybe in a reaction that you're having. So we can tell a lot from the tongue. And we want to give you this information so that you're empowered to take action.
All right.
Data is no good if you can't do anything with it.
Now, I told you, because we have a very short interview and we're running out of time. Yeah. I said, what are the 10 or 15 or 20 things that this does? And you said, I mean, how many things?
This is going to get so long, but let's talk about the 4 basic categories.
Okay.
Teeth, the structure of your teeth, fractured teeth, decayed teeth, infected teeth. Gums, number 1 by far is inflammation. Inflammation. Inflammation is a sign of a deep infection in your gums that you may not know about. And it's poisoning you each and every day. So it will
detect if you're having swelling of your gums?
Yes.
Even at like a little half a millimeter level?
And not only that, but over the course of time, it will learn who you are and what your normal gums look like and if you're experiencing any changes.
Something you said that I missed, I guess, on our phone call, that if you have a crack in your tooth,
yes,
an early crack, it'll detect that?
It depends. There are some limitations to how microscopic. It does not replace an X-ray.
Okay.
Right? So we don't want it. It does not replace an X-ray. But what it is doing is giving you those early signals about what could be going on.
But if you have a legitimate crack, it'll pick it up?
If you have a legitimate crack, it'll pick it up. If we see evidence of grinding, which will likely mean that you might have some cracks that you should get.
So if you have a crack, then you could go to a dentist.
Correct.
And get it repaired.
Correct.
Before it costs a lot of money.
Before it costs a root canal, crown, or extraction.
Is that right? Okay, because then usually when you crack a tooth, it's usually not when you're driving by the dental office. You're on vacation and everything else.
Exactly. But yeah, the idea is that we can do this beforehand, before it gets out of hand. Preventative, like we talked about, which can be hard to sell, but saves a whole lot of money.
Okay, so you knew you were going to come on the show.
Yes.
Final message. Somebody watching this, listening to this, they heard what you had to say. It makes sense, 20 seconds to brush your teeth, upper and lower. What's your final message? Maybe they're skeptical, or maybe they're saying, I don't know. What do you say to them?
Well, I just say, look, the technique is built into the brush. See how you're brushing your own teeth. Are you brushing for 2 minutes? Would 20 seconds help you save time? Are you have confidence in that you're brushing with the right technique each and every time, twice a day, morning and night? Right? I would ask those questions. And if the answer is no, or you have some question, you don't have to disclose it to me. But if those answer those questions yes to yourself, then I think Feno is a great solution for you.
So if somebody orders it today, sends that selfie, they could have it next week or a couple weeks.
They'll get the email for the selfie immediately. As soon as you get that fit kit, we would call it a fit kit. You take that selfie, we'll get it, we'll process it, get you the size, and get it out to you.
That's nice. I mean, we should have brought the box up here, but it's a full box and it has all the stuff. And you guys have put a lot of effort into making the design look good.
Yeah, there's a lot of effort and thought into this. There's a lot of care and love into this, right? I think at the end of the day, I'm a provider. I'm looking to take care of you. And so I want you to feel that in each and everything that we do, whether it be the design, the image, the way that we approach you, our customer service, but, and most importantly, the way it works.
Could a dentist, periodontist, these are the gum guys.
Yes.
Right? Everyone I talk to is like negative about everything. But could they poo-poo this? Could they say, I don't know?
I think they should have questions. And if they don't, then they don't know what's been out there in the market.
Well, how are they responding now with this?
They're asking to try it and they're loving it.
Okay.
If you go on our social media platforms, you'll see other dentists, you'll see periodontists, you'll see
the
meticulous of the meticulous using this and talking about how Feno is a benefit. We got some really exciting studies that are going to be published later in the year, which will be published by dental schools, the top dental schools in the country.
Is that right?
Yes. So I'm saying this with confidence.
You're an oral surgeon that went to Stanford, right?
Yes, sir.
You also played basketball.
Yes.
For Stanford.
Yes.
So you have a lot of connections. So at the university level, what do they think of this?
At the university level, they're excited that someone actually took the time to integrate the true brushing technique into a device like this. Not taking shortcuts, not just injection molding some silicone to make it cheap or to go super fast, right? We're really taking into consideration the true technique of brushing your teeth, so you don't have to.
It seems like such a no-brainer. I mean, 4-year-olds, everybody knows you're supposed to brush your teeth. 80-year-olds know you're supposed to brush your teeth, and they're just not doing it correctly. You think there's just not enough emphasis on a better way to clean the teeth?
There's not enough emphasis and importance on how oral health is your overall health. That's what I would say.
Is that right?
If we realized how tight our mouth is to the rest of our body, we would all be brushing 6 times a day.
You have really white teeth. I don't know if the cameras can pick that up.
Yeah.
And you use this
I use this twice a day.
Just twice. Why not 3 times?
Mostly because I'm in meetings all the time.
Could this cause gum recession if you overdo it? Because some people are going to overdo this.
Great question. Yes, you want to be careful about how much you use. We will not let you overdo it. So we actually have parameters on here that prevent you from brushing too hard or brushing too long.
So do you
So once
you just hold it in place?
Once you place it in your mouth, we ask you just to move it in small circles, right? We all have that one tooth that's a little bit off, or we all pack food in this one little area. So all I want you to do is move it in small circles to make sure that you get that little area.
What about kids?
Yes, kids are our number one next. We really want to address children. The dental arch changes a lot. And so we want to make sure what we get right is that sizing. We need those bristles to contact the teeth. Right? And as your little one is losing teeth and the big ones are coming in and they're all sized different shape, we need to make sure we address that appropriately.
Because parents can't get their kids to brush their teeth properly, especially at night.
I'm a dentist and I have a hard time. I'm wrestling my kids to get their teeth brushed.
They use it?
They do use it.
They like it?
They like it.
Do their friends use it?
I have not allowed their friends to use it.
What?
I'm only experimenting on my kids.
Okay.
We're not out in the market yet with children.
Because I guess with children, because the mouth that they grow, and you have to kind of change
you have
these
to
out.
accommodate.
Oh, I see.
You have to accommodate the different sizes, right? From your 2-year-old to your 8-year-old. When they losing those 2 front teeth and those 2 front teeth become real big, we want to make sure that we can get bristle contact on all those teeth.
So you probably researched the lookalikes on the market. Is that correct?
Thoroughly.
Are you convinced that this is much better?
Yes, hands down, hands down.
Right?
Hands down. And the reason I can say that with confidence is because I know how much work we put into this. I know that when we went out and find a physicist to help measure the sweep of our bristles to make sure that there's enough sweep and enough friction on your teeth, I know that when we go do clinical trials and we're dyeing teeth to make sure that all the plaque is removed so that we, plaque staining tablets, because I know that when we go and research 20,000 different arch shapes and sizes to create the appropriate size for you, I know the amount of work we put into this, and so I'm very proud and very confident in what we've built.
So if you try it, you're going to be hooked, in your opinion.
Yes. We do say that there's a learning curve of about 3 times. And the reason that is because the first time, you just can't believe it happened that fast.
That's it? Like you feel like you didn't brush your teeth.
You're like, wait, that can't be it, right? The second time is because you're just like, oh, okay, well, I like it a little bit this way, I like it a little bit that way, right? And the third time, you're a pro.
Let's peek into the future. Are you going to have like whitening treatments that'll go along with this, things like that?
We're going to do a lot of amazing things. We're going to do some really cool things with toothpaste and the ingredients. We're going to do some really cool things with saliva and salivary biomarkers. We're going to do some really cool things with supplements in toothpaste. So we got a really awesome, innovative roadmap ahead of us as we just go on to revolutionize the way we take care of our mouth.
Does this have Wi-Fi downloads for updates? Capability?
Yes, it's OTA. So over-the-air updates we can do. All the scans will go into a HIPAA-protected cloud. So we will always make sure your data is secure, and it will only be shared with whoever you would like to share it with. If you would like to share it with your dentist, if you would like to share it with your significant other, or from children to parents, you control that.
So it's a smarter way to brush your teeth.
A smarter way to brush.
Okay, now this is maybe not a good question, but do you offer any kind of a money-back guarantee if somebody just hates it?
Yes, absolutely. Yeah, absolutely. Because we just want you to try it.
A week?
30 days.
30 days.
30 days. 30 days.
So it's worth a try.
It's worth a try. It's worth a try. And we believe that you'll be hooked after the 3rd try, right? And 20 seconds, you just can't beat that. I mean,
and the replacement is, for members, is $15?
$15. We recommend
every 3 months.
We recommend every 3 months.
So $45 a year.
To save thousands.
And then you have great teeth. You're smiling all over town.
And to save thousands.
Life is good.
Yeah.
Look, I want to thank you for coming on the show.
Thank
Dr.
you.
Brown.
Thank
it was interesting stuff. And I wish you guys a lot of good luck. And I'm going to have to get one.
I appreciate it.
I am sold.
All right. Thank you.
You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.